Hello and welcome everybody to a quick Take 5 interview with the wonderful Mr. Peter Jones. Pete, thank you for making time for us today.
My pleasure.
So Peter is the very first nurse practitioner epilepsy in Australia. Pete, can you tell us what that means?
Yeah, well simply it's I have the best job in the building.
I'm sure you do.
Yeah, so I'm a registered nurse, but nurse practitioners are the nurses that have chosen a specialty field to work in. So for me, obviously that's epilepsy. We've worked in the field for a number of years, and then we've gone on to do some additional studying through university. So above and beyond what you would normally do to become a nurse. And that's been very focused on our topic of choice. Now, ultimately what that leads us to is a much broader role. So we have an extended role as nurses, and what we're able to do is we're not only able to treat patients that you would see as a nurse normally, we're able to meet the patient, to diagnose, to start the treatment process, and we can prescribe medications, x-rays and scans and so on. So it's a higher clinical role.
That's
that we're
fantastic. So people can come and see you in the clinic,
yes,
here at the Mater Hospital in the
Absolutely.
Epilepsy Clinic, and they can come and see you in the clinic in addition to seeing other neurologists and things at different times. For things like medication, they can see you.
Absolutely. So we work very much as a group. We work as a cohesive team, so the nurse practitioners working with the doctors and the medical officers, and we provide shared care but with different perspectives. That's the great thing.
Right. So you come from the perspective of the nurse.
Absolutely, 100%.
Right,
100%.
okay. And Pete, I've heard you use the term holistic care for epilepsy. Tell me what that means and why it's important.
Holistic care, certainly as a nurse and as a nurse practitioner, it's an essential way to deliver the necessary care to any patient. Now with epilepsy, that's incredibly important. We need to look at the person not just as epilepsy, we need to look at that person in their entirety. And we look to see what has epilepsy caused for that person that we need to address. So not just the seizures that they're suffering from, but the effect that the seizure has. So really simply, we look at every aspect of that person's well-being, and you make sure that every aspect is then addressed. Now as a nurse practitioner, that's great, because we can look, we can diagnose, and we can say, okay, the big impact for this person right now might be something to do with their mobility or their speech or their general well-being, and we're able to then refer to other services. So we can bring in the physiotherapist, and we can bring in the speech therapist and work with them as part of a team to meet all the needs of that person.
Right, and that's holistic care, looking at the patient from all different angles.
Every aspect.
Not just looking at the brain, looking at the body and all of those other effects. Like, what about medication side effects? Does that come under that?
100%.
Right.
So the medications for epilepsy, we know they're not very kind. They're very necessary, and they do what they need to do. But they nearly all come with a side effect, whether that's being overly sleepy, tired, might be it might alter the mood slightly. So yes, we look at that and we say, okay, what can we do that can help with that side effect?
Right.
And again, as a nurse practitioner, we might look at the dose of the medicine. We might look at other therapies that can help to assist. We can also look, is it something that a lifestyle change might help to address? And if we can't meet that need personally, we can refer to people that are able to help.
Wonderful. It sounds like such an important role in the whole epilepsy care team, and that's just wonderful.
Thank you.
Now Pete, you've spent a lot of time with people suffering from epilepsy, and some of them might be quite severely affected in their lives as a result of their epilepsy, and other people maybe not so much. But I wonder if you can tell me, what's one aspect of that journey, that epilepsy journey, that you think people find the most challenging?
I think overwhelmingly it's the stigma that the condition causes. So it's this feeling that when you're diagnosed, that's who you become. You become Peter with epilepsy, or Steve with epilepsy, or Sue with epilepsy. It's not the case. And it's about it's about owning the condition and being in control, but not letting that condition define you. So these are the things, and again, this links in with the quality of life that we hope to influence through the work that we do. So to me, that's the overwhelming trend or thought that comes through in the clinics, and these clearly become a point of focus for us to help that person through.
Yeah. And finally, Pete, one last question. I think I might know the answer to this already based on what you just said, but if you could really lift one particular burden point or one particular thing that you could change for people that you see every day with that experience of epilepsy, what would it be?
It is exactly what we just spoke about.
Yeah.
I would love to shout from the rooftops that this doesn't define you as to who you are.
Yep.
This is a bad hand you've been dealt. This is a condition you did not ask for, but there is help and there is support. And if there isn't complete success with the first medicine, there's others to try. If the medicines don't work, there's other pathways to look at.
Yeah.
So I would do everything I could to scream loud and clear that it's not who you are, it's a condition you didn't ask for, and to help to take that stigma away somewhat.
Yeah, I would love to be a part of that as well, Pete.
Thank you so
hopefully we
much.
can both be a part of lifting some of that stigma. Thank you so much for
My
joining
pleasure.
us, Pete. Really appreciate your time. Thanks everyone for checking out this video, and we'll see you again soon. Bye.